Hi, I'm Kristen Ciombor, and I'm a GI medical oncologist at the Vanderbilt Ingram Cancer Center in Nashville, Tennessee. So circulating tumor DNA, or ctDNA, is being utilized and investigated as a method of detecting minimal residual disease, or sometimes called molecular residual disease. I think probably in the colorectal cancer space is where we have perhaps the most data in how to use this, but there are still a lot of unanswered questions. So for instance, this year we've seen several big presentations, both the Galaxy study, which is the observational component of the Circulate Japan study presented at ASCO GI, and then the dynamic study presented by Dr. T, both at ASCO and then more recently at ESMO. So in these studies, really looking at the presence of ctDNA postoperatively, so after surgical resection of the colon cancer, for instance, can determine if patients are likely to recur or not. And the big question is, how do we utilize that information to make treatment decisions for patients? So there are some instances in which I think we're close to being able to use that in prime time. For instance, in patients with clinically low-risk disease who are ctDNA negative after surgical resection of their, say, stage 2 colon cancer, I think we feel fairly comfortable in omitting adjuvant chemotherapy, and patients looks like will still have good outcomes. However, there are instances in which we really don't know if ctDNA is sensitive enough to say that the absence of ctDNA actually indicates absence of disease. The technology is not quite perfect, as in most of our diagnostic tests, and so trying to get more prospective clinical trial level data to help us understand in which ways we can use ctDNA as an MRD marker are being explored.